Not all back pain is sciatica, but you'd never know it by how often I hear that word used. Let me tell you about one patient whose pain was given the wrong name, and as a result, they got the wrong treatment. Angela was 44 when she developed deep, aching pain in her low back and buttocks, and pain that traveled down the back of her leg. Her doctor took one look at her and said, "That's sciatica." She was sent for an MRI, but the MRI was normal. She was scheduled for injections anyway. The shots didn't help. Then came the physical therapy, but the physical therapy was built around nerve pain exercises, and not only did it not help, it made her symptoms worse. Months later, another doctor finally did a careful examination and listened to the story of her pain. The truth was realized. It wasn't sciatica at all. The problem was her sacroiliac joint. Same pain, same location, completely different diagnosis. This kind of mix-up actually has a very long history. In the 1800s, before we really understood nerves, all leg pain was called sciatica. Doctors lumped it all together into one condition. Only later did we realize that some pain came from discs, some pain came from nerves, some came from joints at the back of the spine or at the sacroiliac joint near the tailbone. Some pain even came from the muscles that support the spine. Yet the habit stuck. Even today, many people call all pain that radiates into the leg sciatica. It's a catch-all phrase, and with the wrong diagnosis, the treatment will often miss the mark. True sciatica actually has a very distinct fingerprint. The pain starts in the back or buttocks and shoots down the leg, usually below the knee. It doesn't stop above or at the knee. The pain is often sharp, stabbing, electrical, or burning. It can be associated with very discrete numbness in a particular distribution down the leg, and sometimes there's even weakness in specific muscle groups. Other conditions, like SI joint pain or facet pain or even muscular pain, can also look similar, but they rarely radiate below the knee. They're rarely associated with electrical, tingling, or burning sensations. They're not usually associated with numbness, and they're not usually associated with weakness in the muscles in the leg. That's why the diagnosis isn't about what we see on an MRI scan, but about what we hear from the patient and what we find on a physical examination. And here's an even bigger lesson. When we give the pain the wrong name, we often wind up giving it the wrong treatment as well. We've done this with sciatica, we've done this with migraines, we've even done this with mental health. Labels are powerful, but they're only as good as the accuracy behind them. Using advanced tools, we're tempted to just slap a label on a condition without doing a careful and thorough evaluation and without listening to the patient's story. But speed without precision just repeats the same mistakes. So, if your leg pain has been called sciatica, make sure the story actually fits. Otherwise, you're not get better, and you're going to be very frustrated with the treatment that comes later. That's why I built Pain Optics. Check out the link below.